How does COPD relate to nocturnal hypoxemia? Have you ever wondered how chronic obstructive pulmonary disease connects to low oxygen levels during sleep? Let's break it down. Chronic obstructive pulmonary disease, often referred to as COPD, is a lung condition that makes breathing difficult. This happens due to damage in the airways and air sacs in the lungs. On the other hand, nocturnal hypoxemia means that oxygen levels in the blood drop during sleep. These two conditions are closely linked, especially when we consider sleep apnea. People with COPD may have normal oxygen levels while they are awake. However, during sleep, especially in rapid eye movement sleep, their oxygen levels can drop significantly. This is because breathing patterns change when we sleep. Breathing becomes more shallow and irregular, which can worsen the already reduced efficiency of the lungs in COPD patients. When we sleep, the muscles that control breathing relax, and the body relies more on automatic breathing. This can lead to a sharp decline in oxygen levels at night, even if everything seems fine during the day. Nocturnal hypoxemia is not just a minor issue for those with COPD. It can lead to serious health problems, such as muscle wasting, reduced ability to exercise, and a higher risk of hospitalization and even death. Interestingly, men with COPD may experience more muscle loss related to nocturnal hypoxemia than women. The effects of low nighttime oxygen are often overlooked. Patients and doctors sometimes assume that weakness or fatigue is just part of having COPD, rather than recognizing it as a separate issue caused by low oxygen levels at night. Now let's look at how sleep apnea fits into this picture. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep, leading to drops in oxygen levels. When someone has both COPD and sleep apnea, which is known as overlap syndrome, nocturnal hypoxemia can become much worse. This combination can lead to more severe drops in oxygen, increased strain on the heart, higher blood pressure, and a greater risk of complications like pulmonary hypertension. Patients with overlap syndrome are also at a greater risk of death compared to those with either condition alone. Despite these risks, nocturnal hypoxemia in COPD is often underdiagnosed and undertreated. Routine screening for low oxygen levels at night is not always performed. The benefits of treatments like supplemental oxygen during sleep are still being researched. Some studies suggest that providing oxygen at night may not always improve outcomes for COPD patients with mild to moderate hypoxemia. However, more research is needed, especially for those who have both COPD and sleep apnea. If you have COPD, it is important to be aware of the possibility of nocturnal hypoxemia, particularly if you experience symptoms of sleep apnea. These symptoms can include loud snoring, gasping during sleep, or feeling excessively sleepy during the day. Discussing these symptoms with your doctor can lead to valuable testing, such as overnight oximetry or a sleep study, to check for low oxygen levels at night. Identifying and treating nocturnal hypoxemia, especially in the context of sleep apnea, may help protect your muscles, heart, and overall health. To sum it up, COPD increases the risk of nocturnal hypoxemia due to changes in breathing during sleep, and this risk is even greater when sleep apnea is also present. Nocturnal hypoxemia can cause muscle loss and other serious health issues, but it is often missed. Screening and appropriate treatment, particularly for those with both conditions, may improve health outcomes. If you have COPD, paying attention to your sleep quality and discussing any concerns with your healthcare provider is a smart step toward better management.